that lovely young lady that you see there.
Oh,
Our sister Deborah. Yes, she's going to be the moderator. But I just really want to, right. Hello. Is that, yeah, Deacon Elaine, I think you're, yeah, can you put it in the chat what you want to say, because you're not coming through very well. Yes, you are. Yes, you are. So we understand. I hope you can hear us anyway. Don't worry. We just had the reading done by Deacon Marcel. He filled in for you. So hope you can listen in and participate a little later as we go on. Right. So yes, I just wanted to say a special welcome to everyone. And just to explain, I was explaining that our sister Deborah Box is going to be our moderator. You know how she's so good at leading these discussions. And so I've asked her to do that. We also have with us this afternoon, Dr. Chiana, as you heard before, and he's not a stranger to us now because he's done a couple of presentations for us. And I think our sister Deborah will introduce him properly. And we also have on board our sister, Dr. Kathy Dockery, who is going to be here as a resource person as well. And she, I think you will remember, has been a member of our health and wellness team, but she went off studying and then COVID happened and all kinds of things, but she's back on board with us again. So welcome, Sister Kathy May Dockery. Good to have you. So yes, the counseling team that consists of all members of our church and one other young lady who has offered her time, meets on a regular basis. And we are always planning, you know, to do different things that can make a difference in the lives of our people at church. So tonight we had, after our deliberation, we thought that today being Father's Day, that we should look at the whole topic of men and their mental health. But we wanted to stress above everything else, I guess, anxiety and depression, because we kind of felt that those are like the softer, not that they are any less important than the others, but they are kind of, what can I say, everyday experiences on different levels, right? So we've asked our Dr. Chiana to address that whole topic of, you know, as a man himself, to look at this area of men's mental health. And just to say, as the Deacon Boy said, we had a beautiful message this morning in church, and I think some of the things that were said there really kind of leads us into, you know, what we are discussing tonight, because, you know, we talked about, or we heard about the fact that men are supposed to be strong and the leaders, and, you know, they are supposed to be resilient and all of that. And therefore, a lot of people don't think that men should therefore be showing the other side of them, which is called the weaker side. And it is not a weaker side. It's just the other side of all of our humanity. So we hope tonight to look at, you know, some of these issues. And so I am going to hand over to our sister Deborah to moderate the session, and it will flow accordingly. Thank you.
All right. Thank you, Deacon Pauline. I'd like to take this time to welcome our brothers and sisters to another enlightening empowerment session. So the topic for tonight's session is anxiety and depression as experienced by men, owning a positive mental health status. As you have heard previously, our presenter for tonight is Dr. Victor Shiana. Dr. Shiana was my supervisor at my alma mater, Caribbean Graduate School of Theology, and he is presently serving as the academic dean there. So at this time, I'd like us to just take our time to welcome Dr. Chiana as he presents on this very important topic. Dr. Chiana.
Thank you, Ms. Boss, for that warm welcome and introduction. Again, my thanks go to the head pastor, Reverend Dr. Devon Dix, and also the moderator for this afternoon interactive session. I hope that would have been, again, for the mass boys. I heard the voice of Sister Pauline, and again that of Deborah Boss. I also want to use this time to say again to all the fathers on this platform, happy Father's Day. And I trust you had an awesome Father's Day celebration. All right, I've been tasked just to lead this conversation. For me, it's just a conversation. And that will, again, I think is going to provoke some kind of reflection as we look at these two areas, depression and anxiety. I just want to say that anxiety and depression walk hand in hand. Those issues are like brothers and sisters. So either way, anxiety could predispose you or expose you to depression. So you can have anxiety without being exposed to depression. And that's why it becomes so critical as we begin to look into this clinical condition that have a great impact in destabilizing someone's functionality, day-to-day activity, especially when it comes to the issues that pertains to the men's species. As we all know, that matters like this, conditions such as anxiety and depression, is something no man wants to, interact with. When we hear the word anxiety, depression, it's like it is for a specific set of a group of people. But can I say, everyone on this platform is not immune to anxiety or depression. Each one on this platform is so vulnerable, and that's why it becomes critical and important for us to have this conversation in order for us to, one, become aware of this clinical condition, to also be able to arm ourselves with coping mechanisms or interventions that will help us, to combat with these clinical conditions. I don't know if I have the privilege of sharing my what I have to share with us this afternoon. Is it possible for me to do so?
Yeah, you should be able to.
All right.
I think, Brother Delwin, are you doing that from the church? I'm trying to.
Let me see if this is working. Tell me if you're seeing this.
Yes, it's there now, right there.
All right, great. Thank you. All right. See, our mental health has a significant impact on how we move through life, how we perceive ourselves, and how we also interact with others. The mental health that is not healthy, again, will always have a negative impact as it relates to self-view, the view of others, and also view about the world. So mental, physical, brain, psychological, whatever you want to call it, I want to state here categorically that the problems are real. Not only are they real, they are also painful. Not just painful to you who is experiencing those clinical issues. It is also painful to those who are looking after you. In addition to that, it is very costly. And that's why we want to look at this whole issue as it relates to anxiety and depression. Anxiety, according to DSM-5, is often the first mental health disorder noticeable with young men. And if left untreated, it is predictive of comorbid psychiatric disorder, which also includes both depression, bipolar disorder, and psychosis, and the list continues. And just to give us a brief, statistical findings as it relates to these two clinical conditions. Depression and anxiety is not simply a temporal change in mode or a sign of weakness. I think it was Sister Pauline that said that based on this summation of today's message, that this aspect of man that sometimes does not respond to emotional eruptions as a result of cultural normation, that probably you reacting or responding to maybe sudden changes, and probably you decide to drop a little bit of eye water, that is not a sign of weakness. Rather, it is part of human makeup. So, yes, it is not temporal. At the same time, it is not a sign of weakness. I want us to note that both issues are real. They are real clinical conditions with many emotional, physical, and cognitive symptoms. In fact, 30.6% of men experience a period of depression and anxiety during their lifetime. Nearly 9% of men feel anxious or depressed on a daily basis. And about 1 in 10 Jamaicans will experience an major depressive disorder and anxiety even in their lifetime. As we know, women may more likely than men do suffer from depression and anxiety. Can I tell you, even though that is the truth, men 4 times are likely to commit suicide than women. In addition to that, men die. Their death average or the mortality average, as when we look at it, is 7 years younger than women. 1 in 7 young men aged between 16 to 24 experience again depression or anxiety each year. And 5% of fathers develop postnatal depression in the year after having a baby. And I know what you understand what I mean by this. It's not that if we are, yes. So in addition to that, dropout of treatment is more frequent and quickly noticeable with men. Can I say this? Men do not easily assess intervention or treatment. Because, as you know, men have been so culturalized in such a way that they look at this part as a sign of weakness. But no, that is not true. One would want to ask them, what then is anxiety? Anxiety is anticipatory, and in most cases, it is caused by fear. Fear of the unknown, fear about tomorrow, not knowing what tomorrow is going to bring or unfold. So things like that. So fear is the more intense emotion an individual feels when he or she is actually faced with a threatening situation. Fear or anxiety symptoms are considered a disorder only when they interfere with an individual day-to-day functioning. There is normal anxiety. So anxiety becomes abnormal when it is excessive. So everyone, like I said on this platform, we are anxious about one thing or the other, but it becomes abnormal when it is uncontrollable, when it has become excessive. So what it does, it interferes with how you function on a daily basis. It interferes with you, interferes with those around you, interferes with the family system. Every single thing around you is being impacted as a result of the abnormalness, the abnormal component of anxiety. So anxiety disorder are a group of mental illnesses, and the distress they cause can keep you from carrying on with your life normally. People with anxiety disorder share a fixation or constant avoidance of thought and situation that will always provoke fear or anxiety. So there are three manifestations of anxiety, three areas that you can notice. One has to do with the cognitive, which has to do with your thinking, the thought, what you think, and then which also have a behavioral component of it. You know, based on how you respond to what you are thinking. You respond to that which you think. What if? And because of that little thought, what if, you begin to respond either in a negative way or in a positive way. And also, it is also manifested in a somatic way, where like things like physiological or biological reactions, which include like things like swollen or shallow breathing. You see, begin to experience mouth dryness, cold hands frequently, and you see yourself maybe constantly running, using the bathroom maybe every now and then, and so on, fainting and all that. So all of these are the areas in which anxiety affects or manifests your thought, the behavior, and the physical part of your being. I want us to look at this, the vicious circle of anxiety. See, anxiety provoking situation, the physiological, which has to do with the increase in heart rate, muscle tension, sweating, blushing, dizziness, nausea, or stomach ache. And the cognitive part, like I said earlier on, what if? What is about the physiological symptoms, what is about anxiety-provoking situations, and then you will begin to see the emotional aspect of it, where it now introduces fear, dread, panic, frustration, anger, disappointment, even sadness. And then you now look at the output of the causation of anxiety, resulting from the thought which have now impacted your emotion, and the result now becomes you begin to see yourself reducing the performance that you normally perform on a daily basis. You begin to see those areas deteriorating due to, again, anxiety. Sometimes you begin to avoid even places that you once liked to always visit. Maybe again as a result of the impact of anxiety. So you see the circle. It affects the thought. It affects how you feel. It affects even your physical appearance and then your behavior. So those 4 areas. That's why we use the word vicious. When something is vicious, that tells you it does not have mercy upon whomsoever it has grabbed. Let's consider this, the thought, something bad will happen. I won't be able to cope. And then what happens to the feeling, the anxiousness? Darlene, tense heart racing, breathing fast, shakiness, lightheadedness, and the list continue. And like I said, it's either you want to avoid the place, or you trying to look for a way to escape, not to go out. Sometimes you see yourself locking away from the outside world because of the impact of anxiety. Sometimes you begin to see yourself, whenever you begin to not see yourself, make excuses, flimsy excuses, then you need to begin to check yourself. Or you decide to leave early more than normal. Safety behavior helps us cope in situations such as described or mentioned. Depression. Depression is an abnormal emotional state that can negatively impact how you function in all, note, not one area, but in all social situations. It is a mood disorder that causes a persistent feeling of sadness and loss of interest. It also interferes with your daily life functionality and also causes pain, both for you and those who cares about you. It impacts everyone. Everyone within your space will be impacted as a result of this clinical condition. Depression is a common but serious illness. Can I say, depression is the second leading causes of disability globally. So we want to look at the various causes of anxiety and depression. It could be genetically motivated or hereditary. For instance, in a family where, persons who have been diagnosed with depression or anxiety. It could be as a result of major life changes such as probably the loss of a loved one, probably the loss of job. So the list continue. It can also be caused as a result of socio-cultural factors, even which has to do even with what is happening around you. Relationship. Maybe in the relationship is now on a rocky boat. That relationship that once was steady, but now, maybe as a result of so many factors that I don't want to dive into right now, that relationship begins to become so shaky. And probably also your personality could also predispose you to either the clinical condition, anxiety or depression. In addition to that, even there are also what we call environmental causation of anxiety and depression. As we all know today, within our context, there are so many things happening around us that is so frightening, at the same time depressing. Just take, for instance, just some weeks ago, when the 8-year-old child was, whose throat was slashed. That to me is so very traumatic, you know, at the same time, you know, alarming. At the same time, could also drive fear into someone. So we can look, when we look at all of these happenings, then you will understand what we are trying to say here this afternoon. Environmentally,
come.
in our space, at the workplace, even right among our family system. There are so many things happening.
Come on, stop it.
Once mic is open, please. Another thing that can also predispose one is the use of alcohol or other drugs. You know, those can also worsen depression. So let me say this, that depression can also occur for no apparent reason. And you just find yourself in that state. What I looked at was just all the factors that contributes to this clinical condition. I also want us to look at it from the biblical standpoint. According to Proverbs 12:25, it says, anxiety in the heart of man causes depression. So that fear in the heart of man is what predisposes the man to be exposed to these clinical disturbances. So notice I started by saying that anxiety and depression, they are like brothers and sisters. They are correlated. So anxiety will expose you, will open you up to get into this place where you become so depressed. Like I stated earlier on, the fear of the unknown, the news that we hear on a daily basis, the occurrences around us, within our space, all of this. Hence why the King Solomon was so kind to expose us to the root cause of depression. Anxiety in the heart of man will cause depression. There are various types of anxiety and depression. I'm not going to go into much detail, but for the anxiety, you have generalized anxiety disorder, social anxiety, specific phobia, panic disorder, agoraphobia, obsessive compulsive disorder, and post-traumatic stress disorder. Whereas on the other end, depression, you have disruptive mode dysregulation disorder, major depression, persistent depressive disorder, premenstrual, that I have to remove that, but I know I only left it there. Dysphoric disorder, substance medication induced disorder, depression disorder due to other medical condition, and other specified depressive disorder. And again, we have what we call unspecified depressive disorder. And common signs of anxiety and depression. For anxiety, you will see increased feeling of panic, fear, uneasiness, heart palpitation, breathlessness, problem sleeping, and nightmares. You increase sweating and or shaking or trembling, twitching, and then you could also see muscle tension. Whereas for depression, you will notice persistent, sad, anxious, or empty feeling of hopelessness or pessimism, irritability and restlessness, feeling of guilt, worthlessness or helplessness, fatigue or decreased energy, loss of interest in activities or hobbies once pleasurable, including sex, difficulties concentrating, remembering details, and making decisions. insomnia, early morning wakefulness, or excessive sleeping, overeating or loss of appetite, thought of suicide, even somatic pains. All of these as common signs of anxiety and depression. However, there are three major signs of depression or anxiety in men, and these are noticeable in these three areas: physical pains, anger and irritability, and reckless behavior. When you begin to find yourself within these three areas, then it becomes a red flag for you to check out yourself, for you to seek out help. Now, traditionally, masculine norms, prizing toughness, narcissism, self-reliance, and emotional restrictiveness may be central in suppressing men's expression of anxiety or depression in ways that aligns with the DSM-5 criteria. So mental, physical, brain, psychological, whatsoever you call it, again, I have to re-emphasize this. The problem are real, painful and costly. I want us to know that. Men can experience depression and anxiety in different ways to women and are more likely to, note, 1, deny their feelings, 2, hide themselves from themselves and others, 3rd but not the least, mark themselves with other behaviors. Although this is a reality for men, you will understand that they will shy away from this clinical condition. They will even hide the same clinical condition from themselves, even when they know that they are experiencing this clinical condition. And the worst part of it, again, like I said, mentioned here, and that's why it's so painful among spouses, among husband and wife. When you hide this clinical condition from yourself, I am thinking that at least you would have at least make it known to your better half, so that your better half could be better prepared to support and assist you during moments like those. What makes you more at risk? Family history, previous history of depression or anxiety, difficult life events, stressors, traumatic event in childhood, marital conflict, increased work demand, chronic illness, and substance misuse. And I also want to say here that for new fathers, what makes them or put them at risk is less practical, emotional, or social support. The feeling that the burden of financial stresses creates as a result of the arrival of a newborn baby. Have the current or past experience with drug or alcohol. Again, anxiety, depression could set in when you know that newborn baby is sick. It erupts that feeling. Major life and relationship difficulties, past and present. As we know, within our context, there are series of domestic reports of domestic violence. And all of this is as a result of these clinical issues that we are discussing this evening, as a result of men not being able to come to the place where they seek help, professional help, to help resolve those issues, which if not managed, predisposes them or exposes them to that societal attempt, which again have become like a norm for us within our context. Find the reality of parenting is different from their expectation. You know, maybe your name before baby came into being, your perspective or expectation as it relates to parenting, as baby comes in now with you trying to, balance work, family life and work life and all the rest, you begin to see that discrepancies coming in, setting in. All of those could predispose you to this clinical condition as a man, especially as a new father. And then for older men, increase in physical health problems, condition, chronic pain, side effects from medications, losses like relationship, independence, work and income, self-worth, mobility and flexibility, social isolation, significant changes in life arrangement, moving from living independently to a care facility. I don't know how you will feel as a man, have knowing fully well that you were this independent, and all of a sudden, as a result of natural causation, you become so incapacitated that you're no longer able to do the things that you once did for yourself. Admission to hospital, certain anniversaries and the memories they evoke. Maybe as a man on this platform, you may have recently lost your wife. And then when those anniversary days comes or moment comes, you see yourself retreating, finding yourself in this depressive state where you can no longer function. I want us to note that our mental, emotional, and physical health and well-being are all interconnected. Our body chemistry affects our emotions. Our emotions affect our thoughts, words, and actions. And our thoughts, words, and actions affect our body chemistry. I want to let us know this, even when it comes to men's mental health, the challenge is not the need for development of new treatment. No, that is not the challenge. The challenge is that men often do not recognize mental health issues in their own life and do not seek help. Because it is what you recognize, what you are aware of, that is what will provoke you to seek help. But once you are in denial, no matter what anyone does, even when help is presenting itself before you, you will not embrace the help. So it is not a matter of developing new treatment. No, it's a matter of you as a man coming to that place where you begin to accept on this clinical